All right, my friends, check him out. This is Steve. He has, as you see, a bunch of muscles on him. One we are talking about specifically today is going to be your anterior scalene. This is the muscle that you have 4 origin points from C3, 4, 5, and 6 in the process right out here. Then, if you slide down, it goes up here and it inserts right here into the first rib. Now, remember, insertion will always pull toward the origin. So that means this pulls that direction. This is the SCM, by the way. Have a great video on there if you want to check. And we got your pack video on there. But, so what this does, so think of him like this. So here's Mr. Steve looking at you. I know he's missing a tooth. But if he were, and I want to show you some of the actions in a little bit. I'll show you some massage techniques as well. But if basically, when he first step, when he breathes, this scalene actually elevates the first rib, which is going to help him in respiration. When it's real tight, you can also be shorter of breath. This will help. So second, it also pulls the neck, flexes him this direction. And I'm going to show you all this. It can help with your headaches. It can help with jaw pain that's referred. You can have, all sorts of face features, your chest. I mean, it's a small muscle, but it's a powerful muscle. So a lot of our flexors are very weak. So we're going to show you massage technique and we're going to show you a strengthening exercise. Check this out. All right, when I work on, as you see, this is the anterior scalene, okay? And when it comes to origin insertion, I try to hit both the origin and insertion points and kind of do a little bit of a stretch with it. So what I'll do when I'm trying to release this muscle is obviously I warm up the muscle, get some lotion on. So I'm going to press into the scalene, right? I usually sometimes use a thumb like this, get right on it. And you can actually turn their head into it, kind of flex, kind of like the action of this muscle. It's gonna flex it down. It's gonna pull from origin to insertion, it's gonna insertion to origin. So when you press into here, remember this muscle, its job is to bring this direction. So it's going to flex your neck. It's going to help when, kind of like this move, pulling like this, tucking your chin. That's going to flex that muscle, which is going to engage it and help strengthen. So here we go. We're going to press under the SCM. So you have the SCM on top. Going to come under there and just press fill the tender points. When you feel a little bit of a tender point, you can press and turn their head into it and release it. And turn and release. Same thing here, turn and release. You'll do both sides. Press along the spine. Try to get in the little grooves right at those connection points. It's where a lot of the tension comes from. And you can push right in the middle of the anterior scalene, do a little bit of a stretch with it, like this. Lengthen the muscle, pinning and stretching. And the other thing you can do for breathing, so remember the job of this one is to bring that first rib up and help in breathing and respiration. So when you press into this first rib right here, it can be very tender, but you're going to press down and have them take a deep breath. At the same time, if you can have them breathe and then lift their head up towards you, it will lengthen the muscle as well. And you're going to hold it while they breathe. Take a deep breath, Steve. Okay, sorry, he doesn't have lungs, but he knows how to breathe. He just does it when I'm not watching. But so you just kind of work the muscle out like that, do some gentle stretching, and like I said, just do some circular motions through this whole muscle, kind of follow the muscle. If you want to add in some SCM work, you can do that, but you really want to release this muscle. A lot of these this muscle gets inhibited. So we want to now I'm going to show you an exercise real quick, and you're going to start doing this at home or teaching your clients, and this will night and day help your clients. Ready? Check this out. So tell your clients to start doing this every day. You can do it when they wake up in the morning, get off the edge of their bed. They don't even have to have they don't have to have a massage table, but they can just get off the edge of their bed. What they're going to do is, you see how it's hanging down like this. You want to bring your head up, tuck your chin back like this, and hold. And you really want to focus on your neck muscles until you get a little tired, and you're going to relax. And again, tuck and hold. Keep doing that. Now, what you don't want to do is this. That's not doing it. You want to flex your neck. Engage your neck flexors. Next, grab a resistance band like this. Put it across the top of your head and pull against it. And just practice. Don't overdo yourself. Do some sets, do some holds. Don't push yourself too hard though, because I don't want clients overdoing it. So tell your clients to start doing this every day. It's going to help now stretch. Because remember, we just did all that workout and that massage. So we now want to do some good lengthening. Let them rest. Arch over. And just let it relax. Don't sleep on this thing. Thanks for watching our video today. I hope you liked it. Make sure you comment below and hit like. And we'll see you next time. Thanks, Steve, for being a good sport. He's tired now, he wants to sit down. So we'll see you next time. Make sure you follow us and subscribe to our channels and comment your thoughts. Have a great day.